Hi everyone, welcome back. Thank you for joining us today for yet another miracle that I want to share. I'm sitting here today with Garnet, who's traveled here from Arkansas, and we're going to hear her story in a little bit. But her case is similar to Diane's case, which I'd shared earlier. Just to refresh you guys, this is a 42-year-old female that had been diagnosed with metastatic ovarian cancer. So again, this is an ovarian primary that's spreading throughout her body. She, like Garnet, Diane had also had surgery, but by the time she reached our office, about January of 2016, which I think is that when your diagnosis was as well? So that's another similarity between these two women. Diane's tumor marker was at 72.5, CA-125, it's an ovarian tumor marker, and subsequently, with no chemotherapy and no radiation within 6 weeks, she was hoping that her tumor marker would be down in the 40s, high normal again, 38, and when we rechecked it 6 weeks later, it was 15. So, you know, we certainly praise God for that miracle. But then the question might be, well, okay, Dr. G, I mean, that's a 42-year-old healthy person. You know, certainly God can't pull off something like that in a 66-year-old, right? Well, it turns out that kind of happened, you know, lightning struck twice. And so again, this is Garnet, and I'm going to let her kind of tell her story.
I was diagnosed in January of 2016. I had surgery that same month. I started my chemo in March of 2016. Before I had surgery, my cancer level was 877. After my surgery, it went down into the 70s and 80s, and it just, after I started my chemo, it kept going down, and it got down as low as
the 25 that you told me, I think, right?
Yes. And then it started going back up. I was chemo or cancer free in August of 2016, and then kept getting it rechecked, and it started going back up gradually, and it got up to 65.5, and the chemo doctor was wanting to do chemo on me again, and I said no. And a friend of my daughter's said, why don't you take her to Ganino's in Texas? So I did, and praise the Lord, it just kept going down and down. So now it's at 30.1, I believe, from 65.5. So I'm just praising the Lord.
Amen. Yeah, so again, this ovarian tumor marker we're talking about is called a CA-125, high normal's 38. So when we met each other, it was 65.5, and with no chemo and no radiation therapy, basically what we've been doing is just coaching her up on ways to get her body stronger, ways to detoxify her body. There are natural treatments that we do here that are able to kill cancer and make her stronger, such as intravenous vitamin C, for example, and which is contrasted against chemotherapy, which of course kills cancer and makes the patient weaker. So can you maybe just share a little bit about the decision making, you know, because you're at a choice point, you know, this doctor's saying, you know, our recommendation, since it's going back up again, is for you to do chemo. So at some point, there was a choice point there, number one. Number two, I, like you, am very spiritual, so I'm just kind of wondering how that whole spiritual piece kind of might have come together in that moment where you decided to come here as opposed to go back and do that.
The cancer doctor told me that I needed to have chemo again, and I got to thinking, well, how much more chemo will I be able to take, and when will it stop? And I've always been a spiritual person, and I knew that God could take care of it. And then when the friend of my daughter's told her to bring me down here, my daughter told me, said, Mom, you can either live with cancer or you can die with cancer. I'm not gonna die with cancer.
Amen.
I'm gonna die with old age.
There you go.
So I don't think the Lord's through with me yet.
Yeah.
Coming down here, I feel like I've got it under control.
Yeah. Great. Yeah, so again, just a testimony to, what's possible when you lift prayer and then, you decide to follow it and trust it and see it all the way through. The next thing that's possible is to witness a miracle. So, Garnet, we thank you for being with us today. We thank you for, sharing your testimony with everybody, and I thank you all for watching, and certainly anybody in your life that you want to share this story with, we'd love you to, pass it on and let them know as well about, what's possible, and that there are options that can be done when facing things as big as metastatic cancer.
Yeah.
And again, it doesn't have to be mutually exclusive. We have a lot of our patients that combine, things like surgery and chemo and some of these things, radiation, with what we do. And most of these people have a really good outcome because at the same time that the chemo and the radiation is chopping them into little pieces, we're sort of picking up the pieces and rebuilding their immune system at the same time. And it seems to be working out pretty well. So again, thank you very much for tuning in, and we'll keep these miracles coming.